Welcome back to the show. This is Real Talk with me, Nick, keeping you guys company, keeping it real 100% all the way until 4 p.m. And yeah, we know we're talking about a lot of things. And one of the things that we were talking about today is, how, there is a lot of talks, especially going about the passport, the vaccine passport, of the possibility of a vaccine passport. And well, the people in England, aged over 50 and in at risk categories are being urged to book their COVID-19 jabs before next Monday when slots are already set, because the slots are already set to dry up. And the plan is to get everyone vaccinated age 50 and above. So yeah, the plan is actually, towards the end of July to get all the adults in the UK to be vaccinated, and most of the people, at least 20%, to be getting their second dose of the vaccination. That's right, the second booster dose of the vaccination. And the NHS, the National Health Service, has said that anyone who currently qualifies but has not had a first dose of a vaccine should arrange an appointment by the time of the 29th of March. So yeah, the officials expect a slowdown in the vaccine supplies in April, and medics will be focusing on providing the second doses. So if you're 50 and above, you can already expect your second dose. But if you have not gotten your second dose, you better make your appointments now, because by the time you should arrange it by 29th of March, because the second dose vaccines will arrive at around mid-April. So yeah, ministers say the plan to offer a first dose to all adults by July is still on track. The roadmap is still happening. The four-way roadmap is going to still happen. But the NHS England said no first appointment should be booked next month for people under the age of 50 unless they fall into a higher priority group, such as, those who are clinically vulnerable. So people who have immune compromise, those are the people who can get their vaccine jab at around that time. So yeah, people under the age of 50 are unable. They cannot be getting their vaccines anytime as of yet until all the people above the age of 50s and 60s get their vaccine. So 4 in 5 people in the first 9 priority groups have now received at least one dose of the vaccine. And the NHS England medical director, Professor Stephen Powis, said it is a statement to the careful planning and sheer hard work, of the staff of the NHS vaccination program. And, they're continuing to protect the people against coronavirus at a record pace. So yeah, he further says, that he was thrilled to get his first dose earlier this month. And yeah, it was quick, painless, and safe. And it feels great knowing I've got protection against COVID-19. So if you're eligible, do not delay. Book a jab right now. That's what they're trying to say, And if, in case you guys are wondering, when can I get my vaccination? Well, the government has warned that supplies will fall in April, but says all adults will still be offered a jab by the end of July. So who's being offered a jab right now? Well, the UK is using the AstraZeneca vaccine and Pfizer vaccine to protect people against the COVID-19. So the adults aged between 50 to 54 in England are now being urged to get their first dose in the next couple of days, which is the 29th of March. So the other next is that text messages are also being sent out with a link to the National Booking Service website. So people can also call the service on 119. Then the people over 50s are also being offered the vaccine in Northern Ireland and Scotland. And it's hoped everyone over 50 in Wales will be offered their first dose by the mid of April. So, which groups have been given the first priority? Who have been given the first dose? Well, these are frontline workers, the frontline health social care staff, elderly care home residents, clinically extremely vulnerable people, over 16s with some health condition which increase their risk from COVID, adult carers of disabled people, and younger adults in care homes, and everyone else over the age of 55s. So yeah, all 4 nations of the UK follow these priorities, but the rollout varies between England, Scotland, Wales, and the Northern Ireland. So if you're wondering when people over the age of 40 will get their jabs, well, people under 50 will have to wait until May, and they'll be vaccinated in the according age order. So it's going to be the people who will be prioritized will be people between the age of 40 to 49 first, and then 30 to 39, and finally 18 to 29 years of age. So those are the age groups. I'm going to repeat them again in case you guys missed them. It's 40 to 49, 30 to 39, 18 to 29. Those are the three age groups. And then it's according to that chronological order that people will be getting their vaccine. So, yeah, priorities will not be given to people in particular jobs. And which is limited and not sorry, which is not limited to only teaching as well. So this could, slow down the vaccination program because, the risk is closely linked to someone's age, making vaccination by age group the most effective way and efficient way to protect the population. So, yeah, some groups, though, are at high risk of needing hospital treatment from COVID and are urged to take up the offer of vaccination immediately. These are basically, men, Black, Asian, and minority ethnic communities, people with a BMI over 30, and those in a deprived neighborhood, impoverished neighborhood. So, yeah, when can you be expecting your vaccines? Well, it's going to be from the dates are just crazy. So most of it will be from January to the 15th of February. Most of the old people in these resident homes, care home workers, healthcare and social workers, and all those age 70 and above have received their vaccines. And by the time it's end of Feb to 15th of April, all the people between the age of 60, 69 and 16 to 64, and everyone else between the age of 50 to 59 will be receiving the doses. And the second phase is essentially by the time it's July 31st. And all of those, according, like I said, 40, 49, 30, 39, and 18, and 29. So, yeah, in case you guys are also wondering when you're going to get your second dose of the vaccine, well, more than 2.5 million people have already gotten their dose and are fully vaccinated. And during April, the number of second doses are expected to be approximately or around 12 million. So, yeah, that's around 12 million doses. And this is, the people who are in these priority lists will be getting the vaccine accordingly. And yeah, the other question is that we are going to be asking ourselves is, do these vaccines help against the new variants? Well, two vaccines developed by Pfizer and AstraZeneca are being used in the UK right now. Third one, Moderna, has also been approved, but then they say that the Oxford AstraZeneca vaccine is going to be providing, like, it gives a good level of protection from the Kent variant, also dominant in the UK. And the other ones, they're not quite sure whether the other vaccines will work against the other variants. And the other ones that are spotted are the South African variant and the Brazilian variant. So, yeah, those are just a couple of the variants that are out there. And there's also a double mutant variant in India just recently we discovered. So, yeah, that's just something we're not quite sure. They're not quite sure, rather, whether it's going to be effective 100%, but they are confident that it's going to be effective to a certain extent against these other variant groups. So, yeah, but in the end of the day, you got to realize if you get vaccinated, the more people that get vaccinated, the less people will get the coronavirus. So that's something that you have to also be thinking about. End of the day, we are all accountable for what we do and how, whether we stay protected or we stay vaccinated. It's our responsibility to, take care of ourselves as well and not spread the disease as it is, as it's going. And the other thing that most of the people are also wondering, do you really need to get two of these doses? Do you really need two of the vaccines? Well, these vaccines are approved and you are required to take two doses to provide the best protection against coronavirus. So, yeah, in the UK, people were initially told they'll get a second dose 3 or 4 weeks after the first. But to ensure a quicker rollout of the first doses, the UK's chief medical officers extended the gap to 12 weeks. Now, a lot of people are wondering, and doctors are worried, they're worried that there's going to be, a big spread, a big gap. And if they're worried and concerned about the effectiveness, the efficacy of this vaccine, and whether it can be even efficient between that window, especially between a window of 12 weeks. So, yeah, now this approach, though, has been approved by the WHO, who say giving two doses 8 to 12 weeks apart increases the Oxford vaccine's effectiveness and provides greater protection. So, yeah, that's just something that they are talking about. And in case you guys are wondering, there's like how many vaccines are there and which one should I really take? Right now, there are 3 that are approved. There's some others by Johnson and Johnson and all that other companies that are being approved. So let's see how it goes as time moves on. But with that being said, though, we got to step into some more music. Up next, we got something by Dua Lipa, though. And this one is called Fever. So check it out.